Welcome to That's Anita Live, the talk show dedicated to providing emotional healing to help you create a happier life. My guest today is an expert in maternal mental health. Postpartum has been highlighted for centuries in our society, but not many of us understand it. We view the event of having a baby as something that would be a joyous event. But Kristen Brooks is a licensed clinical social worker, y'all pray for, and owner of Building Beyond Therapy. She earned an MSW from the University of Maryland, Baltimore, and is clinically licensed in Maryland and in the District of Columbia. For half a decade, she's provided social work services in many capacities, including child welfare, inpatient psychiatric services, and in schools. But more importantly, she's certified in maternal mental health through Postpartum Support International and is a board-certified supervisor with the Board of Social Work Examiners in Maryland. Board-certified supervisors.
Yeah.
You go into public schools?
Yes, I work in a public charter school in D.C.
We're going to pray for you.
Please do.
But let's start with the maternal mental health. Most of us would view having a baby as a very joyous event. But for the mom that is experiencing postpartum, first, let's start at the top with what is postpartum?
So I guess we should actually take a step back.
Okay.
So when people think about postpartum, they strictly think about depression. But nowadays we call it more perinatal mental health or maternal mental health, because depression and anxiety and psychosis all fall underneath of that umbrella. And it's something that doesn't just happen after the baby is born. Oftentimes the numbers are just as high during pregnancy as they are after a baby is born. And so having a baby can be a very joyous event. But there are times where there are barriers to that joy. And so that's what my focus is.
What are some of those barriers?
So some of those barriers could be, it could be lack of support. It could be stress during the pregnancy. It could be that, there's a genetic predisposition for some of those postpartum issues or some of those perinatal issues. And so those things can get in the way of the joyous feeling that someone may have around being pregnant or after having that baby.
So, okay, you said it was more than just depression. What does it look like to those of us on the outside?
So depression, when most people think about depression, they think about, oh, I'm sad or I'm crying all the time. That depression can look like agitation. It can be anxiety, as I said before. It could be you kind of think about short fuse. It could be that someone's maybe not eating or sleeping well. It could be that they're hypervigilant, and so that they're very overprotective of that baby. Most people think about a woman having postpartum depression as possibly wanting to hurt their baby. It could be the exact opposite, that they're afraid that everything outside of where they are will hurt their baby, and so they've become overprotective of that baby.
Now that's what it looks like to us from the outside, but inside to the mom, what is she thinking and feeling?
Overwhelmed, shame, guilt, feeling as if something is wrong with her. Oftentimes with depression, it could lead to suicide or suicidal thoughts because they feel that their baby or their family may be better off without them being present, when in reality, that's not the case at all. But it's very much an internal battle. It's something that is scary to share with others. I myself struggled with postpartum anxiety after my second daughter, and I remember feeling like I was in a cloud. And it just felt like a cloud was around my head. There was this fog all the time. And so it can be hard for other people necessarily to see it, but it feels very debilitating to that person.
Now, being the professional and having the experience, how did you express it?
I denied it, actually. I was in denial, and it's funny because my husband, who is in computers and has no interpersonal skills,
she'll snap out of it.
He was the one that came to me and said, do you think that you have postpartum? And I was like, what are you talking about? I'm a social worker. I don't have postpartum. Like, I know what these signs look like. And it wasn't until months later that I was like, oh, yes, I do. And so it can be hard as a professional. So you're still living in it.
What was he bringing to your attention, though?
He said that, but he never really was like, well, this is why I think it. But looking back, I recognized that I was very disconnected from my family. Like, our second daughter was born early, and so I had a lot of that shame, a lot of that guilt. I felt like it was my fault, and I became very overprotective of her.
When you say early, you mean?
She was preterm. Well, so she was born 5 weeks early, so she was considered premature.
Okay. Okay.
So she spent some time in the NICU. And so all of those things kind of compounded on themselves, as well as I mentioned before, having some issues during your pregnancy. And I worked in a very stressful environment when I was pregnant.
Yes, you do.
Well, actually, when I was pregnant, I wasn't working in a school. I was working in an inpatient psychiatric unit. And so that was very stressful.
Okay,
exactly.
But they have some similarities.
Absolutely. Absolutely. And so that stress during my pregnancy.
Okay, hold on. That stress during your pregnancy caused you to behave in what way?
I had very short fuse. I was very overwhelmed. I felt like, you know, I could never catch up. Okay. Is how I felt during the pregnancy. Okay. And so after she was born, and she was born early.
Hold on. How old was your first daughter when you were pregnant with the second?
How old was she? She was about to turn 2. So I also had a toddler at home.
Now, did she mirror to you any of that behavior?
She actually asked me. She said, "Mommy, why are you sad?" And I was like, "What are you talking about? I'm not sad." Because I was just sitting there. And then I burst into tears, and I was like, "Oh, I'm sad." But it was the people around me and the people outside of me that saw that.
The toddlers generally are very perceptive.
That struck a nerve, and I was like, "Oh God." But you know, it's even as a professional, I didn't see it in myself because I was too close to the situation. It was happening to me, and so it was everyone around me that had to bring that. Even my 2-year-old daughter, who brought that to my attention, and even still, I was in denial. No, I'm fine. I don't want to hurt anybody. I'm okay. You know, I'm not depressed, and it didn't happen for a long time that I recognized that was an issue.
Then when you did.
When I did, I think that I had started to move out of it, and so I'm fortunate enough to have a very supportive family, very supportive friends, a lot of friends who are also social workers, and so they kind of social worked me without me realizing it. But it sparked my interest in maternal mental health and really helped me, you know, drive me toward that path that is exactly what it is that I want to do and want to focus on, because I felt like I was alone during that time, and I learned very quickly that I wasn't at all. There are a lot of people who felt the way that I did, but no one really talked about it.
So how did you begin to seek help?
It was forced on me. It was forced on me. Like I said, I have a lot of social workers who are around me, and they're like, "Oh no, we're going to talk about it.
We're doing an intervention."
Oh yeah.
Yeah. Okay, hold on. Paint that picture for me. What happened?
So I started to notice that when I would talk about my younger daughter, I would just immediately break down in tears, and I was like, "Oh, I don't know why." And they're like, "Because you still feel this guilt, and it has nothing to do with you." And so those messages over and over again, that it's, you know, her being born early or, you know, me being stressed, it didn't have anything necessarily to do with me. I could not have done anything differently for the situation to go a different way. And so over time, those messages and that support and, you know, people saying, "Oh no, we're going to take the baby and you're going to get rest," was very helpful. My husband is extremely supportive. And so all of those things, having that support built around me was extremely helpful. It helped me to kind of remove myself from the hole that I felt like I was in.
Once you accepted it, how long did it take for you to begin to feel your normal baseline again?
I don't know that I really went back to feeling normal again until almost a year after she was born. And so I think that there are times where people think about postpartum depression or anxiety, and we're only looking at it in the first couple of months. And so statistics show that 1 in 7 women can experience a serious depressive or anxious episode, and develop those symptoms within 3 months. But in reality, studies have shown that if you look past those 3 months, those numbers get higher. So 1 in 5 women will experience those symptoms. And so I remember, you know, you go to your follow-up appointment after your 6 or 8 weeks or however long, and they'll screen you for postpartum depression or anxiety, and they'll ask you, do you want to harm yourself? Do you want to harm your baby? Oh yeah. And as a professional, I know why you're asking me those questions. So I'm like, of course not, because I didn't feel any of those things. But had someone asked me other questions, are you feeling overwhelmed? Are you feeling guilty? Are you feeling shamed? I would have answered yes. And so that screening, though, stopped there, because you don't have another appointment for another year. You know, as long as everything's okay, you're okay. And so I think that I learned very quickly that it's important that we continue to screen throughout that year, because those numbers get higher past that 3-month mark. Things don't get easier once your baby is 3 months old. Things get harder. after that point.
Feed
and so
me, change me.
absolutely, rates of suicide increase. It could be up to 7 or 8 months after birth. And so when you don't have that support, or you don't have someone constantly screening and checking for those things, or that are knowledgeable about those things, you kind of feel like you're alone.
Is it a difference between women that are married and women that are single moms?
I'm sure that there is, because there's a lack of support. But I think that what's most important is screening. And, you know, if let's say that the screening was happening in pediatric offices, within that first year of your child being born, you're in the pediatrician's office all the time. You have, you know, checkups and shots and illnesses and all those things. And so if those screening questions are being asked about what supports you have, asked about how mom is feeling, then you're able to build that support in earlier and be able to catch those things earlier.
Now, what can a mom do when a mom to be, when she first finds out that she's pregnant, to care for her mental health?
So if it's a mom that already struggles with mental health issues, it's important that they seek some type of help. If they are on medication and they don't want to continue medication, then that's fine. But seeking some type of therapeutic help, some type of support group, something to really keep you connected, and so that you have a safe space to share what those feelings are. Because there are times where, like you said, people view pregnancy as a joyous occasion. There are some mothers that are not happy about being pregnant, and other people would think like, oh, you're not happy, but some people weren't ever expecting to have children. Some people didn't want to have children, or some people did want to have children.
Not going to, not on the list.
I remember,
don't have any.
I remember when I was pregnant with my second daughter, one of my coworkers was very upset about her being pregnant. She never intended on having children, and no one around her understood that she was upset about it. And so I had to tell her, it's okay. I'm telling you it's okay that you tell me you're not happy about it. And I think that was the first time she had ever heard that. So normalizing those feelings and giving people a safe space to talk is what's most important.
Not being judgmental.
Not being judgmental, but that's hard because people see babies and they're like, oh, babies. Everybody's happy about babies. Everybody is not happy about babies.
I'm happy about babies when they belong to somebody else.
And you can give them back.
All day.
Absolutely.
We're going to take a break. We'll be right back to talk about tips that moms can use once the baby is born to maintain their mental health. We are here with Kristen Brooks talking about maternal mental health. What are some tips that once the baby comes that a mom can do to maintain or gauge her mental health so that if she needs that assistance, she can seek it?
Well, the first thing is just to be honest about how you're feeling and not be afraid to tell anybody that you're feeling those things. I think oftentimes, you know, I've heard from people that they're afraid to say that they're feeling overwhelmed or that they may be feeling depressed or anxious because they're afraid that someone's going to take their child. Or that they, you know.
Really?
Absolutely. Or that they may be perceived as dangerous toward their child, because oftentimes people think postpartum and they think you automatically want to harm your child. And so even family members can say, oh no, you know, don't leave them alone, you know, with the baby, when, like I said, in reality, it may not even be that you want to harm your child. You just don't want anybody else around your child. And so just being honest about that and being able to find, even if it's one person in your life, to say, I'm feeling this way, I don't really know what to do about it, but I think that I need help. But sometimes that can be hard when the shame and the guilt is there. And so I think that acknowledging that shame and guilt is the first thing that you need to do before you can really seek any help. Or even saying, I'm feeling that, and now I need help. Because you can't be successful moving forward until you recognize
until you're
that's
honest
there.
with yourself.
Absolutely.
Okay,
absolutely. The second thing is seeking that help. And so I think it's important to be mindful of your provider. There are sometimes, like I said, pediatricians, OBGYNs, even mental health providers may not be as knowledgeable about maternal mental health and what that can look like. And so finding somebody who can relate to what you're saying and understands what that looks like, because unfortunately providers can be judgmental as well.
Yes.
The next thing is really relying on your support system. And so I like to call it your tribe. Like, what does your tribe look like? Who are those people? Identify those people. Who can come and wash clothes for you? Who can come and cook meals for you? Who can come and watch your children for you? Even an hour. An hour break when you have children is essential. It can seem like a full day. But having somebody that's going to come and they're going to kind of pull you away from that. I remember with my first daughter, my mother kidnapped her a few weeks in, and she's like, no, I'm going to take her and you're going to take a break. And I was like, what are you talking about? Like, I didn't ask you to do that. And she's like, I didn't ask if you asked. I'm just going to do it. But it was essential to me being able to still feel like myself. You know, as a mother, you may lose yourself and you feel like, well, I'm only mom and I'm only wife, but you are still yourself, and you really can't help your children or help your family until you've helped yourself first.
You have you maintain your outside interests and your outside activities.
Absolutely. It's like when you're on an airplane and they say put your mask on first before someone else's. It's important because you will pass out first. And so if I'm not healthy and I'm not whole, how can I expect to be
someone else?
An efficient parent?
Okay, so let's talk about some of the things that you've seen working in, let's do schools first, and then we'll do psychiatric wards, and then we'll bring it back into the maternal mental health.
So in working in schools, I've actually seen how a lot of children are negatively impacted by the mental health of their parents. And so more often than not in the school that I work in, it's in an urban area, it's in Washington, D.C., and we do have a lot of single parents. We do have a lot of single mothers. We do have a lot of parents who have their own mental health issues. And so I can see where when those issues are not appropriately addressed, that it negatively impacts their children and their children's well-being and their children's mental health. And so it's extremely important that as parents, we are honest and that sometimes we just have to eat crow and take it and say, I'm afraid to step out and get help, but it's what I have to do in order to be an effective parent.
Is that fear real?
Oh, absolutely.
That someone could take their child because they admit to having some difficulties?
Absolutely. People see it on TV all the time. When I worked for child welfare, when I worked in Child Protective Services, and I remember I would tell people like, oh, I work in Child Protective Services, and they're like, you take people's kids. I'm like, no, I don't. That's not what I go to work to do. I go to work to make sure people are safe. But unfortunately, there are situations where children have to be removed because it's not safe. And so I've seen, again, there where a parent mental health is not stable. And so I think the other caveat to that is it's not just mothers that experience perinatal issues, postpartum issues. Fathers do as well. Partners do as well. Absolutely. What? Absolutely.
But because I guess because when I think of it, I think of postpartum coming a lot from maybe the detachment and where the child depended so much upon the mom while it was in the womb. And they could feel everything. What they ate, the child was affected by. But then once that cord is cut and the child is external, there is a loss or a feeling there that leaves a void. Now, the partner has had nothing. There's no detachment. There's nothing cut. So what is the partner feeling? What is he or she feeling?
So it's this. It comes from the same factors: a lack of support. It comes from, you can be hypervigilant as a parent. You ever heard of like the helicopter parent? The same thing can happen for partners.
Well, I'm from the country, so I think all first-time moms are just
absolutely. So there's and I think that's where it's hard for people, is that there's the normal baby blues that happens and the normal feelings of being a parent, but there comes a point where your behavior or your feelings are no longer normal, and they really do take over your life and become debilitating to a point. And so that's where it's this fine line of people having to really be knowledgeable and understand what's that normal baby blues and what's that, what part of that is a perinatal mood disorder or anxiety disorder or psychosis. And so, I think that oftentimes people forget about partners and think about, if there are traumatic situations or, in my situation, you have a child who is born early, that would negatively impact someone's partner and someone's family. And so I think that sometimes only moms get the attention.
Very much so.
When in reality, we need to be looking at the family as a whole.
Because, I would look at, my brothers, I call them my brothers, but friends of mine that I grew up with, when their wives had kids, I'm like, what are you? You feel what? Suck it up. You weren't the one that was pushing. You weren't the one that dealt with the swelling and the not being able to sleep. And
you still feel it, though. It's very much an emotional thing, not a physical thing. And so, I think that...
So I was being insensitive?
No, I think that it's not necessarily insensitive.
I think it's peace to y'all. Get over it. You know I'm your sister. I'm in it for the long haul.
I think that it's more just about a lack of knowledge. And just so I would say as a culture, right? We very often think like, okay, mom is superwoman, dad is superman, just suck it up, it's okay. And so that's why as a culture, African-American people are not as willing to reach out because they're afraid of systems taking their children. They're afraid of looking like they're not strong enough. We're afraid of looking like we can't handle everything when we shouldn't have to. We shouldn't have to handle everything. If you need help, you need help. And so you have to stand up and say, I need help. There's much more courage in saying that you need help than it is to pretend that you have everything figured out.
I'm blown with the whole partner has a reason to feel.
Absolutely.
Because, and we joke him a lot, but let's say men that take paternity leave. Is there a real cause for that other than being supportive to their partner that had the baby?
So it's about attachment, right? If we think about, if the baby is spending all that time with mom, you're creating an attachment, you're creating a bond. Why shouldn't dad have the same thing? Why shouldn't he have the same ability, the same opportunity?
Because he could still smoke cigarettes and drink beer when she was pregnant. That's why.
You still want to create healthy attachments. Healthy attachments start from birth. Absolutely. Absolutely.
Attachment. Okay.
Creating healthy attachment. I have 2 daughters. If my daughters only spend time with me, that healthy attachment is only being created with me, not with dad. And so they need to have that same opportunity, that same chance to have
so
that
the
with their
maternity
father.
period isn't to deal with the loss, because a lot of the time when we think of maternity leave, we think of it as her body is in repair from the trauma that it has been through.
Medically, that's what it is, which is why they only give you 6 to 8 weeks. But in reality, if we're looking at what is going to create a healthy attachment, what is going to foster healthy family relationships, 6 to 8 weeks is not enough. In 6 to 8 weeks, I'm not ready to go back to work.
How long do y'all want us covering for y'all if y'all to come back into this job? How long we got to cover for y'all?
It feels like that, I'm sure, on the outside. But when you're home, it's like, I'm not ready to leave. I'm not ready to leave this baby. I'm not ready to go out and leave them with somebody else. Because now when it's time for me to return back to work, I now have to shift that parenting role to somebody else in my absence. And that can be hard. That can be extremely hard.
I actually convinced two of my friends to become stay-at-home moms.
Don't we all wish we could?
Once I broke down for them that they would just be paying daycare.
Oh, don't even get me started.
Your salary is only in this area. They moved to this area while they were pregnant, or they got pregnant after they moved here. You're only going to be covering daycare with your own salary.
My husband and I spend more in daycare than we do in our mortgage for 2 children.
Oh, I'm choking.
So when people ask me, are we going to have a third? I'm like, why would we do that? We cannot afford to have another child.
Well, you can try for a boy.
No, I'm okay.
There's no point now. Once you got 2 out.
Chances aren't looking great because I have 2 girls. I'm okay, though they're enough. They are enough.
Are you an only child?
No, I'm one of 5. I am not my parents. I am okay.
So what does grandma? I'm sorry, it's not grandma anymore. It's now grandma.
No, she's fine with grandma. They're both fine with grandma.
What they don't want? They don't want to.
They do, and so you know what? It's interesting that you say that because I think prior to the situation with my youngest, I wanted 4 children.
Whoa.
And so then after having that experience, both medically and emotionally, it's not great for my well-being for me to have another child. Because
now, I'm joking, we're playing back and forth, but this happens to women every day.
Absolutely. Absolutely.
Which also affects mental health. What is, and you can handle the response because you know I'm just joking you. What are some of the things that some of these mothers out here can say to people that are like, what, you only have 1? Why are you being so selfish?
So a lot of people internalize that because there are people who don't understand that they may have an internal struggle. There are some people who cannot have children. And so they'll get those questions all the time. Well, why don't you have kids? Or there are people who have experienced loss and people don't necessarily know. And so they're like, well, why don't you have children when you don't know that they've experienced miscarriages or they've had infertility issues? And so all of this falls underneath the maternal mental health umbrella in that it's all about education. It really is about educating people and understanding that it's not just about somebody being sad. It's not just about somebody, wanting to harm their child or wanting to harm themselves. It's a much larger issue that as a community and as a society, we need to pay more attention to because there are moms everywhere. And if we're not healthy, how can our children and our families be healthy?
So how would you educate us in the corporate environment to not do that type of shaming to a woman who, now, I'm cool with it, I can handle it. Because once I put that jar on my desk for a college fund, all that goes away.
Absolutely.
All that goes away.
Absolutely.
But for a mom that may be internally conflicted because she only has 1 child, and maybe she had siblings, she knew what it was like, or vice versa, she was an only child and she didn't have siblings, so she wants to make sure but she really deep down inside doesn't want another child.
Normalizing, letting people know that whatever their truth is okay. My job is not to make other people happy. My job is to make myself happy, right? And so I don't have to please other people. Other people could think that I need to go and have more children. I'm all right with what I have, and I'm content with that. But I'm strong enough to be able to say that.
Yes.
And so it's because of the support that I have around me. It's because I've been able to work through whatever it is, you know, that I've had to work through. And so it is essential that people seek help. It is essential that people seek help and really rely on those supports that they have. Create those systems. If they don't already have them in their families, there are plenty of groups. Seek groups, seek different, you know, colleagues, friends. Look for that support in your community.
So, okay, let's break that down. Where in the community could they look for that support? Because you mentioned some groups.
Postpartum Support International is a great website. Moms 2020 is a great website.
Hold on, you said Moms 2020?
2020 Moms.
What's that?
So it's their maternal mental health community support groups. They're all over the country.
Okay.
Postpartum International is also, you can go on there. They have like phone lines you can call. There are groups, there are events. I think that there's a push now for stronger maternal mental health support. And so the supports are there, they're growing, and I think that people just need to know that they're there in order to access them.